How do you change the way people feel about health? Through scare tactics, statistics, reasoning, warning. Simply telling them might not be enough. It's time to try something more compelling. Instead of giving information that's technical, how about offering something aspirational? How do you change health communication to make it simpler, clearer, better? Establish C4C, Communications for Communicators School. It's about teaching health communication from a marketing perspective, where the customer comes first, where you become better communicators.
Communications for Communicators. It is the major capacity building initiative of USAID and UH. We are collaborating with the Ateneo School of Government and the JHU because we believe that by transforming health communicators, we would be able to make an impact on the health of our clients, particularly in the areas of tuberculosis, of family planning, and maternal and child health.
C4C brought together over 100 fellows from all over the country, with communication and leadership experts from Johns Hopkins University, Ateneo de Manila University, and Campaigns in Gray. 6 days and 6 months of blended learning. The fellows were challenged to become strategic.
How deeply do you care? And how much are you willing to change? Many become disillusioned. A strategic leader doesn't give up. If you believe, if you have a vision that will help, and you can back it up through your analysis, you gotta push for it.
They were inspired to become effective communicators.
Really getting to know the person that you are selling to, so that when you talk in their language, in their emotional context. That is the best way of doing this.
And they engaged in out-of-the-box learning activities. Despite earthquakes and super typhoons, the fellows stayed on course. The result? 69 projects developed and implemented across the Philippines. Projects that will impact the health of every Filipino.
Communication is a bridge of meaning over a river of misunderstanding.
Communications for Communicators should work within this context. We want good ideas to be viral, so to speak, because these ideas are often meant to invoke new behaviors. Then we must effectively promote a contagion of change. They say that much of the desire to share an idea with others is linked to that idea's carrier. It's the carrier who gets the audience to open up, to trust, and ultimately spread the idea. Furthermore, the carrier is the person who brings the idea into the common vernacular. I hope that the Department of Health and its partners will henceforth have you, our graduates, equipped to translate our policies and messages into good operational ideas that will easily spread and ultimately get everyone to move.
C4C is the Department of Health's approach to raise the standards of communication skills among public health providers. And again, we're very happy, along with our supporters, to provide assistance in this regard. So I also want to commend the creative team of Campaigns in Gray for doing a great job. This was the first time, I think, that USAID in the Philippines contracted with a local Philippine PR marketing company to support implementation of the Department of Health, and particularly, I think, Secretary Ona's vision. And so I think that has also been a great partnership for us. We want to continue to expand on this program because I think it is already creating more demand for the health services and is contributing to better health outcomes in the country. To the C4C graduates, you are playing a critical role in achieving this vision between our respective governments and for the people of the Philippines.
We only not survived the 7.2 magnitude earthquake and the super typhoon Yolanda, but we survived the endless readings and the assignments. We met the deadlines, and especially the terminal report. To all of you, we are still a work in progress, and I hope we can continue our project for the next years, maybe persevere in our being health communicators.